Hackensack Meridian Children's Health is comprised of 2 nationally ranked children's hospitals by U.S. News and World Report and are number 1 in New Jersey. K. Hovnanian Children's Hospital in Neptune and Joseph M. Sanzari Children's Hospital in Hackensack, as well as pediatric inpatient and outpatient services at JFK University Medical Center in Edison. With access to expert pediatricians and over 200 pediatric specialists across the state, Hackensack Meridian Children's Health prides itself on offering specialized pediatric medical care and surgical expertise. To learn more about Hackensack Meridian Children's Health, visit hackensackmeridianhealth.org/kids. Good afternoon, everyone. Welcome back to the Mom with Moms podcast. We are continuing our Family Healthcare Series today with Hackensack Meridian Children's Health. February is rolling very quickly into February, by the way. January was the longest month I ever, and I think this winter has just been brutal, so it didn't help. But February is kind of almost done in a blink of an eye. But I've learned today that February is actually, is it National Heart Month? Or just Heart Month?
I think just Heart Month.
Heart Month, got it. So we are welcoming Dr. Sharon Weinberger on the podcast today. She's a cardiologist locally with Hackensack Meridian Children's Health. And diving right into all kinds of cardiology questions that I have about for kids, heart screenings, the importance of your child's heart health, what to look for, different symptoms, and things that kids are complaining about, when to, I guess, take it seriously, right? Mm-hmm. And things to look out for, because when it comes to the heart, that is some scary stuff. And I have shared before certain things about my health, and also more recently my daughter's, which she's fine. So anyway, thank you for joining us.
Thank you for having me.
We were chatting a little bit before we started here, and I was sharing that Dr. Alpert, who you work with, was my doctor, and he's been on the podcast before. Growing up, I had that vasovagal syncope, which I didn't know was prevalent. I kind of, when I tell people that I have that, they're like, "What? A what? What do you have?" Oh, you pass out, But when I was growing up, I guess I was like maybe 11 or 12. And I don't remember the first time I passed out, but I just remember it was like a series of I kept passing out at school. And it was terrifying. I was in wood shop, and I just woke up on the ground. And in class a few different times, I think maybe at Great Adventure it happened. Yep. So yeah, you're like, I hear that a lot.
That's actually one of my questions. How about at Six Flags?
Yeah. So what is vasovagal syncope, and why does it happen to kids? What is happening there?
So that is a great question. Okay. I actually see that a lot in clinic. And it really, it's sort of two different things. It's either that your blood pressure is dropping a little bit faster than you can accommodate for, or that your heart rate isn't keeping up with what you need. So usually you see it in a person who tends to be sort of long and thin.
Okay.
And I say built like 6 o'clock, like a very tall, thin person. Mm-hmm. And what happens is they either stand up too quickly, or they've been lying down or sitting down for a very long time, and then they stand up, or they've been standing for an exceptionally long time in one place. So first thing in the morning, hot shower, standing in line at Six Flags, which is one of my favorite questions. People in choir who are standing in place for a long time. So they're just standing in one spot. Or actually pitchers on the pitcher's mound also this happens to them too.
Oh. Because they're also kind of built like that too.
Yeah, they're real tall and thin, and they're standing still for a long time.
Right.
And so so what happens is that their blood pressure, their blood vessels in their legs start to sort of dilate. Mm-hmm. And when that happens, the heart has to go faster to compensate for the drop in blood pressure. Mm-hmm. And so what happens is you're not getting as much circulation up top. Mm-hmm. And so you start to get, little flashy sparklies, or your vision goes a little dark. Some people get ringing in their ears, and they get dizzy, they get a little bit disoriented, everything's sort of muffled. If they're able to, be aware of it, kids can be trained to, sit down or sort of bend their knees. And if they're not, and it, your body doesn't recover fast enough, then you will actually pass out. And so, what can be scary is, well, not can be, it's scary, but some kids, when they actually pass out from this, will sort of shake a little bit, and
Okay.
it looks very scary. It looks like they're having a seizure. But the difference between this and a seizure is, in general, when you have a seizure, there's a long period afterwards where you're really out of it, and when you wake up, you don't really remember what happened right before, and that's called a post-ictal state. And in vasovagal syncope, they don't really have that. They can remember everything up until the moment that they passed out. They can even tell you what happened first, the flashy sparklies
Yeah.
or the muffled ears, and,
Yep.
and they like know what happened.
Yep.
And they are generally aware that they were not out for very long.
Yep.
And they wake up, and if you're not careful with a patient who has vasovagal syncope, you try to get them up too fast, they will pass out again.
Yep.
So the best thing to do for them is to keep them down and get them
this.
something to drink, get them something to eat, wait until they're ready to get up,
Yeah.
and then get up slowly. So I see this a lot. It usually starts around junior high or high school, and there's a couple things that make it worse. Being sick, being dehydrated, people with the stomach flu who really aren't eating a whole lot, women on their period, and then people who are not keeping up with what they need. So like athletes who don't drink enough or don't eat breakfast in the morning, and then they sort of run out on the field and they're out for 2 hours and not keeping up with what their bodies need, can have this happen. And to be quite honest, after COVID, there was a sort of burst in patients with these sort of symptoms of the vasovagal syncope, and I think it actually is probably part of long COVID. And what happens is that it sort of peaks in high school and then sort of peters out when you get to college, but it does tend to run in families. So whenever I see a patient in clinic who I think has this, I can almost always turn to the parent and say, did you have this when you were younger, or did your sisters have it?
Wow.
And almost always the answer is yes. And so, and it's funny because sometimes it's the dad, and the dad will be like, oh, this used to happen to me and I'm not worried about it. And like, it really does sort of, it's this very sort of classic picture.
Yep.
And the treatment is as plain and simple as it is really just to make sure that you're eating and drinking enough.
Yeah.
And enough is like liters. It's not just like a bottle of water. It's a lot. You and your Stanley Cup need to be like buddies.
We are.
And yeah.
And salt, right?
And salt.
And salt.
And just, keeping up with yourself and knowing what you need, learning what your sort of triggers are, what's going to set you off. Mm-hmm. And then preparing. If you know that that's what's about to happen to you, sit down. Don't try and be a hero. Don't try and work it out. Just, because when you pass out, everybody around you is going to freak out. So the better you can do with sort of mitigating your symptoms, the better it is for everybody,
And not
especially
hitting your head.
Yeah, not hitting your head. Yeah.
The last time I passed out, this is maybe like, I guess about 5 years ago.
Mm-hmm.
By the way, is much more terrifying as an almost 40 or
Yeah.
I guess I was 35 at the time, but
Mm-hmm.
it's more terrifying as an adult than it is as a kid. And I don't know why,
Yeah.
if it's like that, you have that fearlessness
Fear.
still,
Yeah.
I knew I was actually able to call my husband as I was passing out to let him know.
Yeah.
Because I knew it was happening.
Yeah.
And then like almost let myself pass out.
Yeah.
It's very bizarre. But like you're describing, like you do remember and you kind of like know what's happening.
Yeah.
But as as a kid, yeah, and also back then we weren't as like aware of our hydration.
Mm-hmm.
Now it's like everyone has a Stanley, so it's we
Right.
know the benefits of being
Right.
hydrated.
Right.
So I don't even know if that was really a big part of like my treatment plan as it was now.
Yeah.
But definitely like some medication and stuff. But yes, like where you hear kids passing out on the sidelines and stuff, and being dehydrated. Why? Two questions. One, why do you need to see cardiologists when you have this? And two, what the heck does the vagal nerve have to do with any of it?
Okay. So the vagus nerve
Or
is...
vagus nerve, sorry.
That's okay.
Yeah.
So you have these things called cranial nerves, and there's 12 of them.
Mm-hmm.
And the vagus nerve is number 10. And I love the vagus nerve because it sort of controls everything, sympathetic, parasympathetic.
Mm-hmm.
And so if you sort of remember, like your sympathetic is your flight or fight. So your sympathetic nervous system tells your blood vessels to sort of focus its attention on things that you need to run. So your eyes, your heart, your muscles. And your parasympathetic is what makes you sit still to like digest food or that sort of thing. So it sort of dilates your vessels because you don't need to run in order to digest your food. So when your vagus nerve sort of kicks in, your blood pressure gets lower, your heart rate gets slower, and if your vagus nerve is not reacting the way that it's supposed to, that's what happens to you at just the wrong time. When you're standing in one place for too long, or when you are standing up, that's when you need your blood vessels to clamp down and your heart to go faster so that you can do those things safely, and your vagus nerve is just not helping you out. And it's just, a little bit of neurologic immaturity, and it needs to get there, and it generally does.
Interesting.
When you need to see a cardiologist. So this is very variable. Pediatricians know how to deal with this.
Okay.
And so what happens is pediatricians will tell you, drink more water, blah, blah, blah. They'll tell you all the stuff to do. They're very good. It may or may not be followed. And then what happens is that the pediatrician says, drink more water, blah, blah, blah. And then they're like, well, okay, whatever, fine. The doctor said drink more water. But the doctor also said to take a vitamin every day. And I don't do that either. And so they don't always listen to the pediatrician. And then it keeps happening. And then the pediatrician is like, all right, now it's time to go to the cardiologist because I told you what to do. You may or may not be honest with the pediatrician about whether you did do all the things you were supposed to do. And so we're sort of like their reinforcements.
I see.
It's very rare that I encounter a patient who comes in for this diagnosis who wasn't already warned that that's what was happening.
Okay.
So I find that pediatricians really do know what's up. Mm-hmm. And I also think sometimes parents are just really scared. Like they see their child passing out and it scares them.
It's terrifying.
Right.
Well, also you have to rule out, if your kid passes out, you
Right.
should go to the ER to rule out whether, if it was a seizure or why you're passing out, right? It's not specific, right? Or no?
I mean, it depends. Like,
Okay.
if you recognize that that's what's happening, right? So, this is the other thing that I think people sort of, in their brain, they're only thinking about the 5 seconds before they passed out.
Okay.
Right? So, when somebody comes in and that's their story, I always back it up. Well, what were you doing 2 minutes before? Were you in the shower? Had you just woken up? Were you lying down in bed and then got up and walked downstairs to the kitchen? And then, so it's still the up sort of motion. Mm-hmm. And I think people sort of forget the few minutes before. Mm-hmm. And sometimes it does take a while for your blood pressure to catch up to you. So you can have the up sort of motion and then move for 30 seconds and then go down. Mm-hmm. So I think that sort of maybe just raising awareness about what is a typical sort of vasovagal response, mm-hmm. so that parents recognize it and know not to panic about it. And I think for the most part, kids do sort of take it in stride. Most people do sort of take it in stride when you're little. And I think it's more their parents are worried. The kids, especially teenagers, are sort of invincible in their brain.
Right, yeah.
And they'll pass out and they'll just go back to the couch. They don't care. But the parents are, freaked out. They bring him to the ER and the kid's sitting there on his phone and the parent's worried and the ER doctor's like, okay, he seems fine.
Yep.
What's wrong? And so, there are certain things that are a little bit scary. Obviously, if you pass out and you hit your head, mm-hmm. you need to be seen. If you pass out and you shake afterwards, you're not really sure whether it was a first-time seizure or if it was this, definitely go to the ER. If it's, if you're sick and you're dehydrated and you stand up out of bed and pass out, that's more likely to be related to dehydration and vasovagal syncope than something that's, truly evil.
Okay. Interesting. I think it's, and it's just different with every person. For
Right.
me, I know once I pass out, I'm really shot for a couple days. Mm-hmm. It just really takes a toll on my body. Mm-hmm. But like you said, I know that about myself. I've also already had the workup of
Right.
everything.
Right.
My daughter, a couple months ago, more than that, I guess about 6 months ago, was complaining about heart palpitations, mm-hmm. that her chest hurt, mm-hmm. chest pain, mm-hmm. Probably for a few weeks. So I ended up scheduling an appointment with with Dr. Alpert, mm-hmm. and we ruled out everything. There's nothing structurally wrong.
Right.
She got a clean bill of health and really attributed it to perhaps just kind of growing and,
mm-hmm.
Maybe, nothing, no sound for alarm, right?
Right.
But, with kids complaining about chest pain, about having heart palpitations, mm-hmm. Parents should always take that seriously. what are, some things that that could be, like reasons why you would take your child to a cardiologist?
Things that you should definitely bring a child to a cardiologist for without any hesitation is passing out chest pain or palpitations during exercise. So if you're, running full out on the soccer field and while you're running, you're feeling this chest pain and feeling like you're going to faint.
Okay.
That's like, do not pass go, do not collect $200, right to cardiology, like immediately.
Okay.
And if it's happening even at that time, or God forbid you actually pass out on the field, that's an emergency room trip without question. You should be calling 911. Even if the child wakes up and feels fine, if they were on a full out run or doing their, in the middle of an activity and then they pass out, that's a 911 phone call.
Got it.
Chest pain, by and large, is actually, in pediatrics, this is another big misconception, is actually rarely cardiac. And when they've studied this in large volumes, they've found that less than 1% of the time, chest pain is a primarily cardiac issue, and the other 99% of the time, it's either anxiety, reflux, asthma, or musculoskeletal pain, meaning pain of the chest wall. And so I think that divergence is there because parents sort of ascribe adult heart problems to children when that's really not the case. Like, unless there's a horrible family history or there's something already going on, like the children don't have atherosclerosis unless we know that their cholesterol is bad and high. Most children, when they have chest pain, it's one of those other four things. And so when a child who is, sort of growing and experiences chest pain, and there's very sort of a classic, like they point to one specific spot and it's this really sharp pain. It happens when they're sitting still or when they're exercising, and like it lasts for a few minutes and then it just sort of goes away. That's very classic non-cardiac chest pain.
Got it.
And that's the majority of the chest pain that I see. And it's sort of a very classic story of exactly that. And they can take the tell is the one finger. They have one finger and they point it to one spot, and they can't tell me when. It just happens all the time. It happens when I'm getting ready for bed, and it happens when I'm walking in class. I'm like, okay, fine. And you sort of have to tease out the history to figure out which is which. So I don't expect parents to be like, oh, it's definitely this. Some parents have a clue. Some parents know their child has asthma and hasn't been taking their inhaler, or everybody else in the family has asthma. It's probably this. Some parents, think like, oh, I think he's anxious. That's probably it. I see a lot of chest pain in, we have some very, very good high schools in Monmouth County, and the kids that go to them are very high achieving type A, and they get chest pain. They get chest pain during tests, and they get chest pain when they're studying for tests or when they know something big is coming up. So their chest pain tends to be more related to anxiety.
I see.
The chest pain that I always take seriously, no matter, even if it sounds like it's benign, that I always take seriously and do the entire workup head to toe, is athletes. For a couple of reasons. Athletes know their bodies very well. They know what's normal and they know what's abnormal. And they also don't complain because they don't want to be told that they can't play.
Okay.
So if they're coming to see me for something and there's a chance that they could be, limited to play, then I know that they mean business, because otherwise they would just push past it and keep going. So with athletes who complain of chest pain, and it usually happens for them during sports, they get the full workup. I'm looking for all the structural anomalies. I'm looking for arrhythmias. I'll run them on the stress test and try to make them have chest pain while they're exercising, because you never know. And with that specific group, because I feel like they're sort of exceptional in that they have been paying attention to how their bodies work, them telling me that their chest hurts is worthy of attention.
I see. Okay. So let's dive a little bit deeper into that. I know that there are school screenings for this particular reason about, trying to rule out and detect any type of cardiac issues with more specific, I guess, with athletes, but kids in general, right?
Right.
Is it a specific diagnosis, or is it something that, like, so a kid passes out, right, like
Right.
on the soccer field,
Right.
and they, is it one thing that they all have cumulatively, or is it something that sometimes they have something structurally wrong? Does it limit their ability to, well, is it treatable? And then also, is it something that is like a death sentence for some kids? So like let's talk about like the levels of severity here.
Okay, so I think the first thing to know is that student athletes don't have heart disease more than kids that don't exercise.
Right.
It's just that they get more attention because people perceive them as sort of these superstars and they're getting more attention. And also you think like they shouldn't be, right? But, because they can do all of these amazing things, that their heart should be perfectly fine. The other thing to know is that with sudden cardiac death, 50% of them happen at rest or in their sleep. So, I mean, like, when you have like Bronny James, that was a very big event. That's actually sort of a rarity. Most of the time, kids that have something wrong with their heart, it's not when they're out and exercising. It's when they're just sitting there doing nothing at all. And so in student athletes, the most common causes of death are actually pretty variable. So they can have a heart rhythm problem that's sort of triggered by activity. They can have a problem with their heart muscle. And the most common cause of sudden cardiac death in athletes is something called hypertrophic cardiomyopathy. And that's when your heart muscle is too thick. And then you can have a problem with how your heart muscle is actually being fed, where you have a problem with the actual coronary artery. It's either coming off in the wrong place or it's blocked or something like that. And so in all three of those cases, exercising is sort of increasing the adrenaline in your body and it's sort of stimulating the heart to squeeze harder, faster. And so you have one of those three things that's going to exacerbate it.
Okay.
With hypertrophic cardiomyopathy, because it can overlap a lot with athlete's heart, sometimes the symptoms are sort of mild or the EKG is sort of on the fence, and so it can be missed. And so some of it is found after the fact.
Yeah.
And again, it's one of those things where like athletes may have had sort of chest pain or palpitations and they don't want to say anything because they don't want to be told, taken off the field. And so a lot of them probably had symptoms before, but they didn't want to say anything. And so they sort of brushed off the earlier stuff until it gets to a much more serious stage.
Okay. So for kids that do have, it is detected, is it treatable? How does that work?
Right. So it depends what the cause is. So if you have an arrhythmia, most of the time this is treatable.
Okay.
And even some of the more serious ones, which people didn't used to let play, now they have medications and they have all sorts of sort of guidelines that allow people who weren't allowed to play. So the most famous example of this is something called long QT, where your heart the electric current in your heart just takes too long to reset. And that can trigger fatal arrhythmias, especially when you're swimming. And there is an Olympic swimmer named Dana Vollmer who had long QT, and she had an event and she wanted to swim. And she and her doctor worked together. She got what's called a defibrillator, and went back and won a silver medal in the Olympics with long QT.
Okay.
There are cases where the coronary artery comes off abnormally, and that can trigger, shockingly, a massive heart attack. That is an actual heart attack in children. And once that's sort of placed, you will have some restrictions and you're watched very carefully, but normal activities you can do and certain sports you are able to do once your heart has recovered.
Okay.
With hypertrophic cardiomyopathy, depending on what kind you have, you obviously take medications. You can also get a defibrillator. There's procedures you can do to sort of debulk the muscle, and many of them play sports as long as they have sort of precautions in place.
Okay.
And what I love about the state of New Jersey is we have this thing called Janet's Law. And Janet's Law is life-saving. And what that is it requires every school in the state of New Jersey, K through 12, public, private, does not matter, has to have a defibrillator on site near the field for gym or for any school-sponsored sports. So if you have a game after school, the AED has to be there. And there have to be, at any given moment, 5 people on the grounds that know how to use it.
Okay.
So if, God forbid, something should happen, because the state of New Jersey is so proactive about this, the ability to deal with it is much stronger, much better, and the likelihood of surviving this event in this state is much higher because we have all these precautions and preparations in place. So that's something that I like to reassure parents about when their children have one of these diseases, that the school is sort of ready.
Yeah.
They'll take more precautions, but they're actually ready.
Okay. Do you recommend that all children get a cardiac workup of some kind, or is it really only if they're complaining about or displaying symptoms?
So this is a great debate. The cardiologists say no.
Okay.
The sports people say yes.
Okay.
So this is fabulous. So this comes up a lot, and the debate will never end. There are some pediatricians in Monmouth County who everybody gets an EKG when they hit a certain age.
Okay.
Without the context of their family or their own history, the EKG is just 6 seconds of their life, right? That's all that is. That's a 6-second block of time. So if you have an arrhythmia that's not there all the time, and you do a 6-second EKG, and then you turn around and tell the parent, oh, it's fine, then if the child has any symptoms, you've now blown them off, right? So just screening everybody has its pluses and its minuses. You might capture something, or you might be falsely reassuring people.
Interesting.
The best person to screen is your pediatrician. The best person to do your sports screening is your pediatrician. And this has been studied. And that's because your pediatrician knows you the best. They know your family. You come in when you're sick. You sort of chat them up, and they, you hear stories, and they tell you stories. And so, if you need... So first of all, everybody who's going into junior high and everybody who's going into high school should be having these sports physicals.
Yeah.
And anybody who's going to be doing a sport. And so what happens a lot of times is parents forget, and then they need the form filled out, and then they go to an urgent care. And then you're meeting somebody who's never met you before. They don't know that you have a sister who died of hypertrophic cardiomyopathy. They sort of have their list of questions that they go through, and it gets missed. And so check, everything is fine. But they don't know that your 12-year-old might not be manifesting that same problem because they haven't hit puberty yet, right? So your pediatrician is the person that you've been seeing feasibly, especially in Monmouth County, since your child was a baby. They've been growing up with you. They've been listening to all your family stories for the last 12, 14 years. And they know so much about you, and they've probably been writing it sort of quietly in your chart the whole time, so that when it's time for your child to have the sports physical, they're like, oh, but what about this? Oh, but remember that time 5 years ago when this happened?
Right.
And so for them, their awareness of your child as their doctor is in a completely different field. So my biggest thing is reminding people, like, you really should go, if you know that you're going to need a sports clearance, you really should make sure that that's with your pediatrician. Just do your best. Like, sometimes you can't. They're all very busy, but they are the ones that know you the best, and they will remember the things that you said. And so they will catch things that sort of flew under the radar for a little while. But they're very good at sort of synthesizing all the little pieces and putting them together and being like, wait a minute, now you need to go to a cardiologist. You've hit enough of my little alarm bells that I think you need to go.
Okay, that's good to know. What if, let's, kind of go backwards a little bit with the babies. What are some reasons that a baby would see a cardiologist? I'd imagine that, do all newborns get a cardiac screening when they're born?
Okay. They do, actually.
So are most things detected before you leave the hospital? And if not, what are some things to look out for to perhaps sound the alarm to bring your child back? And what do you see the most of, I guess, in that age group?
Okay. So all babies do get screened.
Okay.
At 24 hours old, we have a CCHD test, so critical congenital heart disease test.
Okay.
And what that is literally in every newborn nursery, they check your oxygen levels in 2 spots, on your hand and on your foot.
Okay.
And that has to do with just how blood is circulating in your body when you're that little. And so if there is a heart condition that was missed for some reason during prenatal life, this is another chance for this to be caught. And what it does is it catches things in general that cause you, like, pretty horrific heart disease that can, cause blood vessels to be blocked, or it could cause heart valves to be blocked, or even, sort of completely cut off. And so that test is pretty good. They actually just revised the guidelines this year, 2025, to be a little bit more inclusive, to catch more babies. And then after that, if they've survived that, it's pretty unlikely. It's not impossible, but it's pretty unlikely that they'll get home and will have missed something. It does happen, but it's pretty unlikely.
Okay.
And then they're coming into the pediatrician. The pediatrician is also checking those things. The thing that I see most often in little babies is heart murmurs. And a murmur is literally a sound that your heart makes. So it's not that your child has a heart problem because their heart is making a sound. It's just that your heart is making a sound. And so sometimes the pediatricians, again, pediatricians are very good. They'll say, I think this is fine. I think it's this, but I just want you to be seen by a cardiologist just to make sure.
Okay.
And they're usually right. A pediatrician knows when a heart sound is normal and when it's not. So the parents will even say to me, like, he said it was fine, but he just wanted me to be checked. And so murmur is number one. And there's different murmurs that are concerning. There's a couple that are there's benign heart murmurs called a Still's murmur that, some kids just have, and it just goes away at some point in their lives. There's your blood vessels when you're first born actually sort of make noise because of the shape. And then as you get taller, that sound just sort of goes away. And then there are actual heart problems, like holes between the left and right side of the heart, valves that aren't opening all the way. Those make a different kind of sound.
Okay.
And pediatricians are excellent of knowing that's not a normal sound. I'm not exactly sure what it is, but I know it's not supposed to be there. And so those parents come in and they say, my doctor heard this heart murmur and he didn't like it.
Okay.
I'm like, okay, now I know something's up. And so I find that it's pretty uncommon, actually, that a patient comes in with a benign murmur that they didn't already sort of have a feeling was okay, or a pathologic murmur that they didn't know something was sort of wrong.
Okay.
So murmurs is number one. Family history is number two. And so family history of cardiomyopathy, heart muscle disease, family history of holes in the heart, family history of abnormal valves. And they want to be checked, which I think is a great idea. I think they should be getting referred because heart disease does run in families. And that's for babies is usually my top two. Every once in a while I'll see what's called a breath holding spell, which is when a baby gets either super angry and just cries until they turn blue and stop breathing.
Wow.
Or they bang they're running and they bang their elbow.
Yeah.
And same thing. They will just hold their breath.
Okay.
And turn blue, or they turn white as a sheet, and then they pass out and then they wake up.
Wow.
And so I'll see that every once in a while too. And parents for breath holding spells are very funny. Usually they figured out, I don't know how, they all figured out, if you blow in their face, then they start breathing again. And so they'll come in and they'll tell me the story oh, he cries until he stops breathing and I blow in his face and he wakes up. Is that cardiac? And I'm like, no, but that's a great story. And sometimes they'll have videos and I'll look at the video and be like, that's the greatest video I've ever seen. But they're okay. They're okay.
Wow. Okay. Anything with the littles, can they pass out related to cardiac things?
Yes.
Okay.
They can.
All right.
They can have heart rhythm issues that make them pass out.
Okay.
And usually their parents know that something is up.
Okay.
So they will be either they won't look right or they're sort of weirdly fussy and can't be calmed down. And parents just know. They may not know that it's heart, but they'll bring their babies in and they'll say, he's not behaving. There's something wrong with him. He's fussy and he doesn't look right. And they have a heart rhythm issue. And those can be treated. And sometimes there is something called a brief resolved unexplained event, where they have an event where they sort of turn blue and pass out. And so you'll bring their baby in with one of those, and the general pediatrics team sort of goes after all the things that could possibly cause a baby to pass out. So they'll look for reflux, they'll look for seizure, they'll call cardiology, they call all the different people that might have caused this one event for passing out to rule out everything all at once.
Okay.
And again, that's not something that parents don't respond to. Parents respond to that immediately, as they should.
Right.
And I really do find that parents just know. They just know when their kids are not right.
Interesting. Okay. That's scary, though.
It is very scary.
Very scary.
But they're right. Parents respond correctly every time.
Huh. Okay. what to do if you have a child that is displaying some of these symptoms? Do you go straight to the ER? What do you recommend?
For a brewie, for an event like that where they just turn blue and pass out, you should definitely be calling 911.
Okay.
If a child is crying until they pass out and they sort of reliably do it, that's not an emergency. That's actually a general pediatrics issue. Iron usually helps. And so if they are doing that, then you bring them to the pediatrician and say, my baby cries until he stops breathing. And the pediatrician will be like, okay, here's some iron. And then it tends to help.
Okay.
Not 100% of the time, but it tends to help. For, murmurs, they're getting caught. They're being brought in. So, I feel like it's really rare that somebody gets very far in their life without all of those safeguards failing them.
Okay.
Bringing your child to the pediatrician regularly is really important, and listening to your mom's sort of instinct, I think, really does make moms know. Especially, first-time moms sort of doubt themselves a lot, and they say, oh, maybe I'm overreacting. But if I'm seeing a mom in, the emergency room, and they're like, this is my 5th kid, and I'm like, ma'am, yes, ma'am. Whatever you say is the correct answer. This is your 5th kid. I got it. Like, yes, ma'am. I will just do anything you want.
Okay.
Moms know. They just know.
For heart disease in children, and I know, we've actually had, her name is escaping me now, but a bariatric surgeon who treats children. Edna will help me. Sharon Weinberger, she's been on the podcast. Thank you. About childhood obesity. Can that cause heart problems with children? And do kids actually go into cardiac arrest from having problems with obesity? And is there a link there? And or do kids go into cardiac arrest? Is that so uncommon? Am I asking
No.
the random question that
No,
not, okay.
not at all. Not at all. Kids do go into cardiac arrest. Not usually from that.
Not usually from that. Okay.
They do have a lot of health problems related to obesity. High blood pressure, high cholesterol, diabetes, all of those things definitely affect the heart.
Okay.
You can see atherosclerosis. You can see those plaques in children as young as 10 years old.
Wow.
And so, and obesity is a very big problem in this country right now. And I think that people are trying to take it seriously. But even with the best of intentions, even with, trying to improve a sedentary lifestyle, trying to change your diet, all of those things, some of it is actually genetic. And so if somebody comes to see me because their cholesterol is high, I will always take a very detailed history. Which parent has high cholesterol? Which grandparent? Has anybody had any heart attacks? Because if you're genetically, designed not to metabolize this correctly, no amount of lettuce is going to make this work out for you. This is just how your body functions.
Got it.
And so there are very strict guidelines as far as medicating. And those change based on the family history.
Yep.
And, some patients in extreme cases actually sometimes need to be dialyzed to get, some of the triglycerides off. And there are these very high advanced clinics for cholesterol where they have these extreme patients who just genetically, that's the way they are.
Right.
For most people, lifestyle management does help. So, getting out, running and playing and doing all those things, watching what you eat, and really keeping an eye on your blood pressure, trying to avoid things that trigger diabetes, which is also genetic, help. So, obesity is actually a sort of a multidisciplinary thing. So if I see a patient in my clinic for high blood pressure and their labs are off, they're going to nephrology, they're going to gastroenterology, they're going to nutrition, they're going to physical therapy. It's not just one doctor who's going to fix everything. It's your entire body, and all of the doctors for all of the different parts of your body need to be sort of brought in.
Got it.
So, including bariatric surgery sometimes.
Yeah. Okay. Yeah. It's all related. Quickly, we'll talk about heart health. Cardio, right? So, do you recommend kids are getting enough, physical exercise, meaning, more cardio versus I don't think a lot of kids are lifting weights, but maybe resistant or whatever you call it with kids. But like I'm a runner, I love to run. I've heard varying things about whether or not that's good for your heart, especially like with what I have. But I love it, and it's just what I do.
Right.
It's the only thing I do, to be honest.
Right.
I hate the gym. And also what to eat for heart health. Is it important for kids to be taking, I guess omega supplements and or just getting that in their diet? And what do you recommend?
Well, I think any parent would tell you if your kid doesn't want to eat omegas, you're not going to get it in there. Like kids just eat what they want. You can try. I find that so. This is an interesting phenomenon that was not a thing, I think, when I was younger, and I think we're sort of close to the same age, so probably you either. But I found that very early on, kids here super specialize in the sports that they play. And this is not a phenomenon that I feel like when I was a kid. Like if there was one kid in my class in 6th grade who did gymnastics like all the time, but everybody else was like, oh, they did soccer in the summer and they did baseball in the spring and they did, nobody was like going to travel camp. Nobody was like going to these super high, like, nowadays I feel like sometimes I'll talk to parents of like 6-year-olds, 7-year-olds, and their kid is on point. Like these are, and I actually think that can be detrimental for a variety of reasons, not the least of which is the orthopedic end of things. And if you are repeatedly, up on point or you're repeatedly, playing tennis, there's certain joints that they're going to suffer. In general, I think cardio exercise is a fantastic idea.
Okay.
I don't think that it's happening enough. But I think that we also live in a state where we're sort of limited by how much time we can spend outside. Like nobody was outside yesterday. You would have been blown away.
Right.
But I think there's a bunch of different activities you can do, and especially here in Monmouth County, we have so many options. There's pools, there's tennis courts, there's gymnastics, there's dance, there's soccer, there's so much that kids can do to keep themselves active, and you really just have to find the thing that clicks with them. And whatever it is, whatever that activity is that they want to do, try to be encouraging, because the more they like it, the more they're going to do it, and the more they do it, the better their health will be.
Right.
And every kid is different.
Yeah. Okay. Anything in particular nutrition-wise that like you recommend that they get regularly?
Water. Water is a big one. I would say that one of the biggest things that sort of contributes to heart...
Or less of, maybe?
I was just going to say, one of the things that contributes to poor heart health is fast food.
Okay.
And I think that it's, like once a week is like a treat. You can do it, but the rest of the time you really should be sort of, either like getting better fast food, so like getting like, pre-packaged like salads or crudité or something like that.
Yeah.
Or just making it at home.
Okay.
The food that's being made in fast food is very tasty for the time that you're eating it, but the amount of oils and cholesterol and sort of just things that are not very good for you are exponentially higher in mass-produced sort of food than the stuff that you're making in your own kitchen, because you're paying attention when you're making it.
Right.
So I would say the big thing is probably sort of cutting down that aspect of your kid's diet, and just encouraging them to find themselves in movement, whatever that is.
Okay. I think that's a big struggle for a lot of moms is finding that balance and then also, eating the right things and stuff. But it is important. Yeah. I've noticed even like I started taking an omega and like I did notice that it helped like with my heart palpitations and stuff. So I think it's good to incorporate into everyone's diet. I don't know. Well, thank you so much. This was great. We covered a lot of different topics and some really good nuggets of information. Heart health is super important and can be scary if you have a child that has any type of problems, right? So where can moms find you if they need to make an appointment?
Okay, so Jersey Shore just incorporated into their group the cardiology group from Alpert, Zales, and Castro. So Dr. Mitchell Alpert, Dr. Vince Zales, Elsa Castro, Dr. Angela O'Malley, and Dr. Stephanie Chin, who are all working out of Brick and Red Bank, are now also a part of Jersey Shore along with me. And so we have our offices in Brick and Red Bank. We will soon be opening an office in Old Bridge.
Oh,
And then hopefully, maybe in the next year, we're going to be opening cardiology offices in Hope Tower at Jersey Shore in Neptune.
that's great.
So there will be 4 different locations to come to pediatric cardiology if you have any concerns at all, and see any one of the 6 of us.
That's great. When we were growing up, there weren't many cardiologists in the area, so I'm glad that it's growing.
Yeah.
In our community, because it was hard to get an appointment, back then. So that's awesome. Well, thank you so much. We'll share all of the information and details of how to get in touch, and submit your questions if you have any, and we'll pass them along.
Thank you so much.
Thank you.